No one could have predicted this confluence of events just a few months ago, beginning with the COVID-19 pandemic, the ensuing devastating economic crisis, then the death of George Floyd, and now the seismic street protests that are driving a sea change in public consciousness. CEOs across the corporate landscape have added their voices to the discussion and are determined to use their influence to make lasting change. Corporations are in a unique position and indeed are often expected to address issues of racial injustice and social unrest. For over 100 years, the Conference Board has helped the world's leading companies and society at large navigate crises and developed reasoned solutions in the nation's interest. Founded amid the labor unrest of 1916, the Conference Board led to the adoption of workplace safety reforms, compulsory health insurance, and 8-hour work days. We were at the forefront of conversations regarding the opening of the workplace to women, people of color, and people with disabilities. The Committee for Economic Development, the Policy Center, helped shape the Marshall Plan that rebuilt Europe after World War II, as well as the Job Act of 1946, which set forth even further workplace reforms. The tradition continues today with our efforts to shape the public policy that impacts our workplaces, communities, and government. Given these recent events, the Conference Board is launching a series of CEO forums to foster action called Building a More Civil and Just Society. The CEO Forum series will feature CEOs from across the American industries who will focus on actionable insights to address our societal challenges. And today, we are privileged to be speaking with Michael Dowling, a CED trustee, who is one of healthcare's most influential voices and has not hesitated taking a stand on societal issues. As president and CEO of Northwell Health, he leads a clinical, academic, and research enterprise with a workforce of more than 72,000 and annual revenue of $13.5 billion. Northwell is the largest healthcare provider and private employer in New York State, caring for more than 2 million people annually through a vast network of nearly 800 outpatient facilities, including 200 primary care practices, 52 urgent care centers, home care, rehabilitation, and end-of-life programs, and 23 hospitals. Prior to becoming CEO in 2002, Mr. Dowling was the health system's executive vice president and chief operating officer. And before joining Northwell in 1995, he was a senior vice president of Empire Blue Cross Blue Shield. Mike served in the New York State government for 12 years, including 7 years as state director of health, education, and human services and deputy secretary to the governor. He was also commissioner of the New York State Department of Social Services. We are very privileged to have him here today joining us. And thank you so much, Mike, for everything you have done for New York State, for the country, and for the people that you are providing health services for, as well as your employees. And I'd like to start by asking an overview question to you, taking advantage of the perspective that you have as CEO of Northwell and as someone who has been involved in speaking about societal issues. Given the events that followed the death of George Floyd, how would you characterize the social state of our nation today?
I would say that we're in the midst of a reawakening. Not the first time this has happened, but I do believe that our circumstances have changed and our perspective has changed now. We are opening up to new realization that there is endemic racism that has been around for an awful long period of time. And I think the recent developments and the combination of things, I don't think it was just only the issue in Minneapolis, but it's the combination, as you mentioned, of the COVID, of the racism issues that we see evidence in many, many places, and obviously the unemployment and the economic dislocation all coming together has, I believe, changed the way we should be thinking about things and broadening our understanding. And I would hope, and I have suggested this to many people, that now is the time for a lot of people, especially in leadership positions in organizations, to stand back and say, Well, yes, I have now responsibility to run and manage my company, but I now have a responsibility to reach beyond the walls of my company to find out and think about those things that I need to be doing more broadly. I don't think we can stand back and say, not my responsibility anymore. I think anybody with any concept of legitimate leadership has now to stand back and say, I want to become an influencer, I want to become a change agent, I want to become more involved to try to make more of a difference, not just only for my company, but for society in general, because how society in general operates affects how our companies operate. So I do believe that things have changed dramatically. And I just want to say one thing, that there is endemic racism, but we have to be very careful to make sure we recognize that not everything that goes wrong is racist. And they think that there is a distinction we have to make. And I would hope that those people who are out there advocating legitimately don't go so far as to assume that everything that goes wrong is because of racism, while at the same time acknowledging that that's a huge, huge issue that we have to deal with.
Picking up on your point about how we've been here before, do you think this is different? And there's a tremendous amount of frustration among the African American community and people of color that change has not happened fast enough. And
Right.
Why hasn't change happened fast enough? Do you think this is a different time for America, that lasting positive change might now be possible?
Well, I think I would hope so. I have been meeting with and have been out in the minority communities a lot recently, and I have been meeting with my employees and have been meeting with public groups, very open public forums, having open discussions, and there is this sense that, and they're obviously asking for it, that now we need to actually change, but we need to not only just talk about it, we need to do things that are real. We've had this discussion before, and the reasonable people understand that during crises like this, we've actually made progress, but then we kind of slow down. It becomes more of a project. You know, we take care of it for a couple of months, we get a lot of activity, a lot of rhetoric going, and then it kind of slows down. I think what people are asking for now is that we need to see consistency and permanence of activity. It is more difficult today, I think, because of the toxic nature of our politics, the partisanship, the lack of, in my view, and I don't mind saying it, the lack of national leadership that focuses on the concept of unity rather than division. I think all of this coming together will mean, I believe, that corporate leadership will have to fill in some of the vacuum that is left open because of the lack of political leadership. You can only make progress in these things if you believe in the concept of unity, the concept of interdependence, that we're all together in this. This is not just a Democrat or Republican, conservative or liberal issue. This is a fundamental structural issue that we have to address. And that's what I think the need for corporate leadership is more necessary today than ever before. Because if we're not getting it from other places, then we have to fill in the void. And I think that is the great responsibility that is before us right now. We have to unify and not divide. And when I've been out in many of the communities that are very negatively affected by COVID, and I've been out in numerous communities over the last couple of weeks. There is an unbelievable willingness in people in those communities to accept assistance and help, and also suggest what they think should happen. And I think we have to take advantage of this. It's not that we can go in and say, we're doing this for you. We have to ask them what it is they need. So to me, this is about leadership. Leadership is about influence. It's about making a difference. It's about bringing people together. It's about taking accountability. It's about believing in a better future. That's what leadership is all about. And I think that's what we have to be talking about. And I congratulate the conference board for your leadership on this. because I think it is that kind of corporate leadership is needed now more than ever before. We can influence the politicians rather than being waiting for them to influence us.
Yes, and all the polling data shows that among the most trusted leaders in America are the business leaders, and so there's a tremendous amount of leverage and influence there. Yeah,
I think it's leadership we need rather than just management. I mean, there are great managers running companies, but you need leadership. Leadership goes beyond the comfort zones of your own companies and go outside, take some risk, get into areas you're a little bit uncomfortable with, are uncomfortable about, be educated more on the underlying issues that people are concerned about, and bring people together. That, I think, is the concept behind good leadership.
You know, and as you were saying, COVID-19 has really shown a spotlight on the inequities in our society. And most importantly, we're seeing the disproportionate and devastating impact of the pandemic on Americans of color. Can you share with us what you have been seeing? And there's concern that the statistics aren't all there, but in terms of what you have been seeing in the Northwell network, both in terms of your frontline workforce, as well as the victims of the pandemic itself, just what you have been seeing on the front lines.
Well, the COVID, it's a stark demonstration of the disproportionate impact that this disease has had on certain communities and on individuals. We have been out, as I had just mentioned, in many of those communities doing testing. We find that in the Hispanic community, there is about close to a 50% positive rate for antibodies, which means that you've almost got herd immunity. It means that this was unbelievably prevalent in those communities. In the Black community, it's about 30% positive. And in the community in general, it's about 17, 18%. In my employees, overall, it's about 13 or 14%. My employees who live in those communities, who are in hospitals my hospitals in those communities, have a much higher incidence of positive rates with regard to the antibodies. So these are communities with high density, where public transportation is the modes of getting around, where the subways, the buses, crowded apartments, etc. And when I walk through the hospitals during the height of the COVID crisis here, and you walk the floors of every ICU, which I did, it became unbelievably obvious, just as you walk, who were in those beds, people suffering from obesity, suffering from underlying hypertension, underlying diabetes problems, etc. So it's like a stark revelation, which of course it shouldn't have been to many of us, stark revelation about how disproportionate the effect of COVID was on those communities, which then leads to the next question: now what do we do about it?
Right.
What's next? It is one thing to say, yes, that's the problem. Yes, these are the prevalence of the COVID in those communities. So now what do we do? It's the answer to that question that is more important.
Yeah, and what are the major changes you think we should be working towards in order to address and improve the healthcare system for the underserved and at-risk populations?
Right. Well, let me just say one other thing first, that these communities have not just been affected by the disease of COVID, they're now disproportionately affected by unemployment, by the housing issues, by businesses being closed. And businesses, by the way, as you all know very well, that may never open up again. So it's the economic, which, by the way, when a vaccine comes in for COVID, that will handle, for the most part, sometime next year, that will handle the disease part of COVID. But the unemployment and the financial dislocation as a result of COVID is going to be around for 5 to 10 years. We're going to be suffering the results of COVID for the remainder of for another decade or so. These things take a long period of time. So what needs to be done in those communities? I think we need to do more to make sure we provide employment opportunities for these people in those communities. We do an awful lot of that in healthcare, but I would urge every company that, and of course these are difficult times for every company these days, but to the extent that you can expand your employment opportunities in those communities, because employment is the core fundamental premise on which good, sound communities are built. If you're purchasing and buying goods and services and have a supply chain, to what extent are you using minority communities and minority businesses as part of your supply chain network? On healthcare, we obviously have to provide a lot more services on site in the communities that I have been out in a lot recently. There are hospitals in many of those communities, but these hospitals are in worse condition than most other hospitals because they're primarily Medicaid. And if you're a hospital that is all Medicaid, you're a poor hospital with no financial resources. We need to expand community health centers. We need to do an awful lot in the area of behavioral health. And government needs to play a major role here. But I do think those health systems like Northwell and others like us that are in somewhat of a better circumstance, even though we have been dramatically hurt by COVID, it is our responsibility now to go into those communities, engage with those communities, ask them how it is we can help, and provide more services on site in those communities so that we can generate some kind of economic activity in those places. That, I think, should be something every business that is listening into this should be thinking and asking the question, which community is near where my business is? What can I do more in that community over the next couple of years now? How can I get involved with the leaders of those communities, with the church leaders, or with the community-based organizations? How can I provide ongoing assistance and engage them in a way that makes sure that we get their input? That, I think, is a fundamental responsibility of all of us now, despite the fact that every business is undergoing some dislocation. But I think we've got to reach beyond our narrow interests here for the good of the community overall.
And, you know, looking just over to the next couple of months and also what's happening around the rest of the country in terms of COVID-19 and the numbers rising and hotspots happening, in terms of New York and the communities that you're involved with and where your hospital network and healthcare network is the communities that you're associated with, do you think that there is enough testing, contact tracing going on in these vulnerable communities now for us to actually be able to maintain the numbers that New York has seen and having recovered from the spikes?
I think, yeah, they're not, you know, antibody testing is not the problem. I think we have enough capacity to do the antibody testing. When you do the diagnostic testing, that's the swab, I think we're going to run into a supply chain problem again, especially now as schools open up and businesses continue to open up and everybody says that people need to be tested more and more and more. I think we're going to have a supply chain issue. And also, given what's happening in the other parts of the country, much of the supply nationally will be dedicated to those parts of the United States, which could also put pressure in New York and other places that have gone through this and are in a pretty good position today. But I would say one other thing, though, is that, and it's very simple, masks work. If people wear masks, and when it is appropriate, social distance, but the masks work, it is inconceivable to me that there are people out there in groups, and I have people today in some of the cities down south helping out, and I get called, my staff talking to me this morning, and they said that there are hundreds of people in congregate situations, no masks. That is plain, and this is plain stupid. The way you curtail this is, you know, testing, yes, that's all fine. But all the testing in the world won't work if people don't use preventive mechanisms like wearing a mask. We're going to be wearing masks for the next 12 months until there is a vaccine. It is a little inconvenient, but for the good of the community overall, it's important to do it. So any business out there, you should be, being unbelievably strong in your advocacy about people wearing masks. That is one of the greatest preventive mechanisms that we can use. There's one other thing I wanted to mention, by the way, for something I'm very much involved in that other businesses might want to get involved in. I'm very involved in trying to deal with the issue of gun violence, which affects those communities proportionally as well that we talked about, and to see gun violence as a public health issue. 40,000 people die from guns every year. It's a public health issue. Everybody worries about thousands of people dying from other things, but gun violence is a huge, huge issue, and I would urge business leaders to take up the gun violence issue as an issue, as public health, not dealing with the Second Amendment issue, the right to bear arms, all of that issue. It's a public health issue. And if we look at it that way, we can make a dramatic impact by putting precautions in place about gun ownership, et cetera, and safety mechanisms and all of that, because it is a health issue. That's just a whole other piece to the constellation of activities we need to get involved in.
So, Mike, in terms of your societal perspective, your leadership role, what were some of the main influencers in terms of your own evolution as a leader, in terms of recognizing the seriousness of needing leadership and providing leadership on these societal issues?
Well, I was very fortunate to work with Governor Mario Cuomo when I was in government, and he was one of the smartest, most well-educated people I was ever around, and he became a great mentor. My mother, when I grew up in severe poverty in Ireland, and my mother was a person who was very socially conscious, even though she was completely deaf, but believed that you have a responsibility not just to exist, not just to, go to work and go home, that you had an obligation whenever you have the opportunity to make a difference, not just for yourself, and not just for the people just immediately around you, but for the community in general, that we are all very much interdependent. So, and also I think I have been I'm a history buff. I love to read. And if you read a lot and you understand how societies succeed and how they fail and how they just exist, education is a wonderful, wonderful learning tool. I'm just reading a book right now. I recommend it to people who are on the phone. It's called The Red Summer. It's about the summer of 1919 in the United States. One of the most violent summers in the United States in terms of racism and lynchings of black individuals.
Oh my goodness.
2 years after black soldiers who fought for the United States in World War I came back. It's a summer that most people don't know about. But you read a book like that and you say to yourself, man, we've made some progress, but boy, do we have a long, long ways to go. It's not that long ago. It's relatively recent. But when you read the book, you ask, I've been reading it now over the last couple of days, and I'm sitting back saying, we're better than this. We've got to be better than this. Just like I think in today's politics, we're better than today's politics. We can't just be so toxic all the time. We can't be demeaning everybody, being nasty. That if you disagree with with people at the moment, other people consider you, an enemy. We're not enemies because we disagree. We have different viewpoints about what's good for the United States. We can argue it, we shouldn't make it personal. We're those of us who are in positions like the position I'm in, and those others listening, we're very privileged. We're very, very privileged. Not just because we live here, but because we have the roles we have. Now the question when you go home tonight, look in the mirror and say, what am I doing with that privilege? Am I going to work tomorrow morning and then coming home afterwards, or am I going to do something good with it? How am I going to use it? We're a better country than we're demonstrating at the moment. We have to become a much more of a leader internationally. We should be talk about COVID and dealing with pandemics. We should be coalescing with other leadership from around the world right now, China, India, England, EU, saying how together are we going to be handling future pandemics which will occur? They're occurring more frequently now. How should we together be developing a surveillance system that we anticipate way in advance of something happening so that we get better prepared? How do we do it together? This is not a time for nationalism to be fighting one another. This is not a time we can have our arguments, like two businesses can compete, but they can still work together for the good of the community overall on those issues where they have common interests. Anyway, I could go on this for a period of time because I feel strongly about it. We must be better than what we currently are, and talk about dealing with the healthcare issues of these communities. We can't at the same time be undermining Obamacare and the ACA without any alternative in place that diminishes access to healthcare for many of the people we now say we're most concerned about. There has to be consistency in our activities. And some people will say, well, that statement is a political statement. I don't want it to be taken as a political statement. It's just asinine to be limiting, taking action that might limit access to healthcare when the need is to increase access to healthcare at a time like this.
Mike, thank you so much for joining us. Those are such important, insightful, and very moving comments. I really appreciate your wisdom and your leadership and the guidance you have given us and will provide even more broadly through this TCB series and our outreach to make sure that your voice and the voice of other business leaders throughout the country are heard in helping us try and get through these very critical times. Thank you so much.
Well, I'm sorry for talking so much, Laurie, but I feel strongly about these things, and I appreciate you giving me the opportunity, and I apologize for not allowing enough time for questions. It's my mistake, not yours. Thank you.
Well, our privilege. Thank you so much.